Hey there, this is Dr. Jeff Snyder, Snyder Family Chiropractic. I want to share with you something that would be very useful for you. We have patients that come in our office who are often having problems with their upper back, with their neck. They're having headaches, they're having vision problems. They're having issues that relate to the spine and the nervous system. And these people, they have one thing in common, and that is that they work at a desk. But more so, they work in front of the computer. So I'm going to share with you a couple things that will be useful for you in changing your computer posture, so that way you can potentially minimize the need for coming to see me or some other healthcare practitioner. And that is ergonomics. The term ergonomics really is all about the position that you're in when you're doing your work. And so I want to show you here what is the best position to be in. Now, I'm going to do a disclaimer right now, and that is that this is not the best position to be in. That is only because I'm in an environment where I'm in my office here, in my suite where I adjust people, and I'm not usually in front of my computer. I'm here for a moment, and then I'm away from the computer. However, if you are in front of your computer for any length of time, the Mayo Clinic describes a length of time in front of the computer as 30 minutes or more. And I would agree with that. So first off, you want to take breaks every 30 minutes. But if you're in front of your computer for lengths of time where you're throughout the day that goes beyond that, your position should be better than this. But I'm going to show you this position that I'm in here. And the reason why this is not good is because if I'm in front of this and you're working from home or at your office and your computer monitor is low, if you're working on a laptop computer especially, when you learned how to ride a bike, you were told, look in the direction you want to go, because if you look in the other direction, you're going to start to drift off. The same thing happens here. If you start looking downward at your computer monitor, what happens is your head goes down as well. And this here is called tech neck. We are causing problems with our neck now, where the spine, where it has normal position, we're headed in that direction now, and I see a lot of people where their X-rays show up just like this on an X-ray, and they have degeneration that's occurred as a result of this tech neck that is occurring pervasively in our society now, and even with kids as well. So I want to share with you what you need to do to fix this. And by the way, you're going to see embedded in this video or on this page, you're going to see a couple links that will take you to some products on Amazon that I'm going to recommend here at this point. So first off is that you want to be using an external keyboard and monitor if you're using just a laptop. And that would mean you want to elevate this laptop to about this level. If you were standing or sitting, you want it to be high, so that way you're looking at the monitor directly. Notice my posture of my head has changed, okay? If I'm down here, it changes to follow along with the monitor. But if it's up high like this, you're going to need something to lift it fairly high. What I recommend, there's a couple different things you can use. Either you can use a monitor stand that will lift it up high, or you can use a milk crate, which is fairly inexpensive. The other thing that you can use also is an external keyboard and mouse along with that, because you're not going to be able to type when it's this high. So you'll plug that keyboard and mouse in, and then you'll put your keyboard and mouse down below here and type. Now, most of the time you're going to need to have a keyboard tray, which will then put your hands in a more neutral position rather than up high on a desk. Now, if you're working with a laptop, there's another solution, and that is you keep it where it's at, and you plug in, you put a monitor up top, and that would mean, again, you want to have a monitor stand or a monitor arm, which again, I'm providing that information right down below for a couple options on that. But you're going to have a monitor arm, which will hold your monitor up higher, and you'll have a monitor up here like this. You can also use your monitor down below for secondary work, but you want to make this your primary monitor, which means you're typing and you're looking straight ahead. Once again, changes the way that your head is positioned and oriented, so that way you minimize stress on your shoulders. So if you're working from the office and you have a regular computer there with a computer monitor that's a fairly nice sized one, just make sure that if you have that monitor positioned on the desk itself, that's going to be too low. And in fact, if you want, I'd be more than happy to help you in determining if you have your monitor positioned properly, whether it be laptop or whether it be at the office. All you need to do is send an email to us and you'll send the email right to us at team, T-E-A-M, at SnyderFamilyChiro.com. That's S-N-Y-D-E-R, family, C-H-I-R-O.com. Send me a picture, a side profile picture of yourself. Have somebody take that picture, sitting in front of your computer, in front of the monitor, at the position you normally have it at, and I will help you in critiquing that to know whether or not you have the right height or not. So that's my share right now to help you to minimize the stresses on your shoulders, your neck. And like I said, again, look in this video or on this page to see that there's a couple links that will help you to select some products that will be potentially helpful for you in minimizing the stress and improving your ergonomics. Thanks very much for watching.